like you said, an integrated platform for EBS across countries, especially countries that have borders amongst each other, will maybe the way to go. Perhaps an expanded platform like the EIOS. So Africa CDC, this is a challenge for us. I'm sending that to you. And again, for us, Japan, we support different countries and create the learning platforms for different countries to learn from each other. Perhaps we need to start thinking about automating systems and seeing how we can do better with EIOS and really getting member states to take ownership, improve governance and funding for EBS. This will lead me to another, critical component. Thank you so much, Brian. Thank you, Leo. Thank you, Dr. Christian, for that. And I would move to Dr. Richard. Now, he's going to be focusing on how do we systematically collect and analyze environmental information for early warning. So he's an environmental expert, like we said in his intro. And his first question, just building on from border health, as Dr. Ibrahim has highlighted, would be gearing towards achieving a holistic health surveillance environment. How does environmental data integrated to health data contribute to early warning public health surveillance? One Health is critical for what we're doing. So how is environmental? Perhaps later on we'll talk about the animal health. But for now, how does the environmental health data integrated to health data contribute to early warning public health surveillance?
Thank you very much, University, and to all the viewers and panelists for already laying the ground and providing this perspective. But let me just put things in perspective within the context of the environment for the benefit of our viewers. The common proverb tells us that the strength of a crocodile is in the water. And when you look at the environment, data to a healthy environment is just like water to crocodile. And what this means is that the environment provides the air we breathe, it provides the water we drink. And as a result of all this, it provides the food that we depend on. And a healthy environment translates to healthy people. And if there is anything that jeopardizes the environment, which is already happening, like climate change, pollution, and waste, biodiversity loss, which is called a triple planetary crisis, then it weakens the environment, and therefore monitoring of the environment becomes very, very important to have data to be able to intervene. And this is the core of how we can then be able to pick information. And if you look at the reality of the world today, 50% of the GDP of the entire global community, that is about 44 trillion US dollars, is at threat today because of biodiversity loss. When you dovetail down to Africa, 400 billion US dollars lost as a result of indoor pollution, air pollution that is costing the lives of hundreds of thousands of people. And when you are to look at this perspective and put in perspective biodiversity lost, in the past 2 decades, 6.9% of diseases have been associated with biodiversity loss, and actually 60% of infectious diseases are linked to zoonotics as a result of biodiversity loss. And therefore, monitoring biodiversity hotspots and using that data to be able to put solutions become quite very, very important. And the same with climate change, which today, with the changing climate, it becomes very, very important to understand that temperature changes, whether they are droughts or floods, increase in temperatures actually increase mosquito-carrying malaria, increase rodents that come with viruses that interact with humans, increase actually the environment for parasites to be able to strive. And when it comes to pollution, when you use monitoring, especially for climate change, early warning systems to be able to get the data, then they can then be able to inform decisions to be put in place to ensure that at least people can be able to put themselves on a pathway in which they're not going to be able to fall prey to these diseases. When it comes to pollution, we're talking about agrochemicals today from industry, wastewater from industries, agrochemicals from agriculture, and identifying where this pollution is coming, soil pollution, to contaminate our waters that people drink and then later on fell sick and depend on antibiotics and continuous taking of those antibiotics become resistant, leading to antimicrobial, that Africa is actually in headline news. for being the highest region with people suffering from antimicrobial, estimated in the next 27 years we'll have 4.1 million Africans dying because of antimicrobial. And identifying the sources of this pollution, whether it is wastewater, becomes very, very important to be able to forestall. But the last aspect with this monitoring of environment within the health surveillance is that it's not just about identifying risks. It's about also identifying risks and matching them with solutions. For example, one of the aspects when it comes to waste is that waste ending up in landfills actually result to emissions that exacerbate climate change, that only cascade the health emergencies that we see today. But when you are able to turn that waste into using biodigesters into biogas, then it reduces the coal and help people not to depend on charcoal and cutting down the forest, but provide an opportunity to reduce indoor pollution. That saves health. But the waste that is coming out of this biodigester in the form of fertilizer is used to replace chemicalized fertilizer that leach into rivers, into our waterways that people drink and get sick. Data then is collected and informed decision making in not only averting risk, but in also creating entrepreneurial opportunities and engaging government to put in place investment plans. Is the essence of what we call early warning for the environment that leverages analytics and monitoring, provide information not only in the mainstream, but focus on the upstream to forestall the risk, then leverages solutions to take people away from contributing to driving that risk, but benefiting from the solutions.
Thank you so much, Richard, for really explaining that a weak environment contributes to weak health system and weak humans and sick humans. Just like the crocodile cannot stay out of the water and survive out of the water, so we cannot survive out of an environment. And really, really amazing. And I loved how you were able to, highlight identifying risks is not enough. Identifying risks through EBS is not enough, but matching it with action is really critical. And we need to learn and grow, turning the environmental waste into productive economical advantage for communities as opposed to having them contributing to health hazards and outbreaks. Thank you so much for highlighting that and really, having the intersections with EBS. So we're moving back. We're moving to, all right, so one more question for you, Dr. Richard, before we move right in, because of time already ahead. But how can you describe environmental information as it relates early warning surveillance system, and how does it contribute to public health surveillance? So, tying it around the environment, how do we move into action, like you said, but then describing environmental information as it relates to early warning surveillance system, and how does it contribute to public health surveillance?
Any information that is gotten, whether it is from health or from environment or from any spheres of life, needs to end up not only with the end users, but the end users should be able to utilize it to better their lives and enhance their socioeconomic ability and stability. And what happens when it comes to environmental surveillance that informs health is actually the leveraging of stakeholders, and especially the citizens in this case, and citizens leveraging them not just to be end users, but also to be the providers of the data that is important, what we call citizen science. Because when you look at what I said earlier, in communities today within the African continent, over 80% of the entire African continent today being in the informal sector, which I have that Africa is an informal setting, which is not a problem because this is how the continent is set up and how to leverage on that. And with the continent with over 60% of the entire population being youthful, therefore survives that we leverage the abilities and strength and with the tools they have, because the community is living where there is encroachment into a forest and be able to give information. The community is living where they have actually been part and parcel of a stressor or of risk, can be able to give information. The young people today with their mobile phone can be able to give information through their mobile phones. And so leveraging citizen science is a very core aspect of environmental monitoring that we're leveraging. But moving from that is actually how do we then communicate this information in such a way that it can be able to inform policy? Because at the end of the day, policy is the biggest driver of change. And governments leveraging data must be in a form that can help them to make decisions. And here what is missing that has been quite a big challenge for quite a very long time is the data ends up being better, not necessarily helping to inform investment planning. And therefore, leveraging data to then help investment planning, especially from the solutions, what we are calling a value chain approach. That yes, you have the data of risk. Yes, you have the data where the pollution is emanating. Yes, you have the data of the water quality that is beyond human consumption. How do we then bring in the solutions? Those solutions are what attract the community, the stakeholders, the investors, the private sector that comes in to invest in a biodigester, not because they're interested in reducing air pollution or water pollution, because they see the benefit in a biodigester that can be able to not only increase earnings, but solve multiplicity of problems by producing fertilizer that is a market, increasing a 5% compounding rate, and also producing biogas that have a big market across the continent today. Is our data is being used to communicate the risk and communicate the solutions, but bring the investment dimension so that private sector can take that up. And the last aspect here is actually ensuring that this data is getting solutions that can be taken up by young people. If you take the continent today, with over 920 million Africans depending on clean cooking, if you take the continent today with over 400,000 Africans dying because of indoor pollution because they depend on charcoal with no alternatives, but yet simple briquettes, waste to briquettes is a market that is worth 20 billion US dollar. If youth skills are retooled, to then be able to venture into turning agricultural waste into fuel briquettes, they will not just be creating jobs, but tapping into an avenue of opportunities, but helping solve a problem of indoor pollution by providing alternatives to charcoal. Communicating this information not just from risk, using their mobile phones, making sure that governments are engaged to be able to put in place investment plannings and incentives like tax breaks for those who are venturing into the enterprise of briquette making. Those who are venturing into the enterprise of turning well to biogas is what we've been doing, and this should become the norm, and that is responding directly to addressing the health issue, but at the same time also driving socio-economic dimension. And so in conclusion, without leveraging data to make the case for socio-economic impact, for socio-economic and investment planning, it will not be able to make any difference, because what makes people believe and take solutions forward is what they see in it for them.
Thank you so much. What makes people get committed is when they see the interest in it for them. Beautiful. And really, just in recapping some of the high points that I take from this, really fantastic contribution: citizenship science. Hashtag Dr. Richard Mona. Citizenship science. Moving data to policy investment planning. Communicating the risk, but not just staying there, but you bring in investment opportunities to empower the youth and get the interest of private sector. Who knows at the end? Beautiful. Thank you so much, Dr. Richard. Great. Loads of hashtags, loads of takeout from that. And I will connect back to event-based surveillance. This second round, as we move on, because of time, how is environmental data interpreted? Ibrahim has shown us how involving communities and identifying hotspots and all. But how is environmental data interpreted, reported, and disseminated across general public for informed early action and response? And what tools are globally used? And perhaps, you can share with us some of the lessons that have been learned from that. So I'm going to give you just 2 minutes to quickly wrap this up, because we have one more question for you before we go into the last round. Yes.
So, Dr. Yemisi, and also to the panelists, which I think I did quite a bit of this, so I'm going to be very quick. So the core of environmental monitoring, as I did say, is in dictation and collection of different phenomena, and then analytic to be able to draw meaningful deductions. And there are 3 aspects. The first is early warning systems, which we know, early warning systems that determine meteorological risk like droughts, like floods, and even epidemics. And then there is the other layer, which is on data. And data here is to capture data on three levels: primary, secondary, and tertiary data. Primary data using sensors, whether it's for air pollution, and using drones to be able to pick information and get that information and analyze it, and also information from citizens, what I call citizen science. So secondary data, because data is already established and there is a lot of research that is happening in the continent and even across the world. So sometimes it's better to use that data. If we do not have primary data, then be able to make informed decision. And then tertiary data from areas across the continent that have actually happened, and then we can use that then to be able to further validate the primary and secondary data. The last aspect, which I think is very, very important at the moment, is the value chain approach that I mentioned. The data on the risk that help inform not only health surveillance is there, but the value chain approach is still an area that is absent. And that value chain approach, as I did said earlier, focusing on monitoring environmental risk, solutions from the sources of those risks, matching these with solutions, but also monitoring solutions for their viability and optimization is an area that is not happening in the continent. We hear about risk. Yes, what about the solutions? Do we monitor the solutions to be able to get more data from there and leverage that data then to be able to inform more optimization of that very solution, like the biodigester that I mentioned? It may be optimal now, but it may not be optimal tomorrow. And then can we be able to continuously monitor, use the data to inform policy changes in terms of investment planning? The last aspect, which is quite a very important aspect, is the example that you mentioned. In Uganda, there is an example whereby simple mobile phones have been used and solar power PVs used in the community for early warning, whereby what is happening here in Uganda is that flood warnings based on monitoring water levels are actually given to communities when the river is at high risk. And what this sensors does is that it sends information and send a siren or a noise that help the community to move away when there are floods. But the question then becomes, if they are not socio-economically empowered, does that information really change a life in the continent? And therefore, looking solutions that can also empower these communities, like what I said earlier, waste to briquettes, become important. They're solving a problem, but they're also empowering themselves. Because at the end of the day, if you cannot help people to put food on the table and more money in more pockets, you might just be singing quite a very long time.
Thank you so much, Dr. Richard. Thank you so much, Richard, for that. I love your socioeconomic dimensions to all of this, and it's very critical because that's what everybody wants, and so I'm sure that will trigger a lot of interest globally. Thank you so much for that. And just one last question. So in terms of environmental protection, I know you've touched a bit on this, but in terms of environmental protection, resource management or disaster mitigation, what roles can partners and government play in facilitating a systematic environmental data collection, analysis, reporting, and use? I know you've talked about visualization too as a critical value chain tool, but I mean, looking at governance and government, how do you think that, what role can they play, particularly around environmental protection, disaster mitigation, and resource management?
So the role of government is actually to put in place enabling policy frameworks and also the policy incentives to then be able to attract investment. This is the core here. Because the other stakeholders, as we know, need to make available the data that is needed to be able to drive these policy incentives. And the parameters of these data, for example, partners coming in with dictation, monitoring, like we have a lot of private actors who are actually dealing with sensors and marketing these sensors. They're developing them. We have even private institutions that are analyzing data. But the key is, how is that data not government decision makers to be able to put in place incentives? Data has also been the meeting point. That risk is identified. Yes, it's scarce sometimes, but so what? Therefore, leveraging this data to then make sure that the data collection and analysis is actually presented in a form that can help inform investment potential of the solutions that do exist to curtail the risk where it's happening, empower people, becomes quite very, very important. And so government role should center on putting in place this necessary policy in incentives to attract investment to drive environmental risks, including health, and then the partners then have the role to then be able to make available monitoring data and analytics in a way that is easy to be able to help inform policies.
Thank you so much. Thank you so much. Government policy incentivize incentivizing the population about I mean we need to talk to you more around this all of these things Richard, especially around the incentives and social economic empowerment were brilliant, and I like that, and that's really essential in how government promotes ownership and community participation. So thank you for highlighting those, empowering people, through policies, partner coordination, and all of that. Thank you so much.
Can prove that if you tell a hungry child that you gave him or her food yesterday, that means nothing to that child today, which means that fundamentals are non-negotiable. It's about socioeconomics. It's about putting food on the table. The better leverage to curtail risk must be turned into solutions that put food on the table. The second is an integrated approach, like Ibrahim have said. We must ensure that integrated surveillance systems that actually combine environment, human and animal, we use that information to drive socioeconomics. And the last part is fragmentation. The focus on risk sometimes, if you take air pollution, focusing only on particulate matter, forgetting methane emissions and even sulfur and nitrous oxide, we need to then make sure we have an integrated approach. Without that, we might be in this journey for a while. Thank you.
Thank you so much. Amazing panelists, and thank you so much, Richard, for that last talk. I'm going to save a minute or two for Dr. Tigi to do the roundup, if that's okay. But I just want to say thank you to all of our participants who stayed through from the beginning of the session till the very end. Thanks to our amazing panelists for sharing all of this amazing insights with us. We hear a lot of emphasis on integration. We hear a lot of emphasis on unifying our EBS system. We hear a lot of emphasis on innovation, use of tools, a successful EBS that hides and prevents outbreak and epidemic. Yesterday in Nigeria, we had a health security partners forum, and one of the things that jumped at us is that the next epidemic is probably just still cooking up somewhere. And a good surveillance system is what will help that not to hit the world again. And so EBS is one of those tools, is one of those strategies to help us in closing this. And so thank you, our panelists, for connecting this simply, for making EBS sound so simple and doable and integrated, and also for adding the value chain perspective into it, community citizenship, community-based surveillance, border health intersections, and also intersections and the unity between IBS and EBS. Thank you so much, our panelists. Thank you so much, our participants, for joining us today. It's been exciting, and I hope you learned a lot. I mean, it's obvious from the Q&A that you had such a great time, and we look forward to interacting more and hosting more of similar webinars to continue to grow the knowledge, grow the advocacy, and see that we have EBS as a driving force. Finally, thank you to US CDC, thank you African CDC, thank you for the UN EP program, and thank you from me, your facilitator. It's been an honor serving as your moderator today. I'll hand over to Dr. Tigi to give us a wrap. Thank you, and see you next time.
Thank you so much, MSC. What a force. Thank you very much for your fantastic facilitation and really helping us get through this. And I don't know, the panelists, if you can briefly put your video on behalf of my colleagues at Japago, I really sincerely want to thank you. Not only because you shared your experience and insights, but throughout your conversation, you are also giving a really much needed nudge on how we can answer some of those seemingly intractable challenges, like collaboration, resource, working together. And I'm really thankful that you put that by bringing the science, the experience, but also not forgetting the challenges that we're facing. The issues of surveillance and privacy. As you've seen, our participants were actively engaged in that conversation. So I'm hoping some of you will be in the conference in Lusaka, and I ask participants to find time to talk to Leo and Richard and Ibrahim and Christian if you make it there. And also after that, you can get, the passion, and you can sense the passion from everyone who talked today. And something that came throughout the conversation was this issue of coordination and collaboration. And I'm so happy to share that next week, one of the panels that JPIGO is hosting is on collaboration. And, again, a group of thoughtful leaders that are coming to that panel to really talk about what is this new discussion around collaboration. We've really delivered this idea for decades. But I think this international conference in Africa, one of the things that it wants to change is we need to move from having a webinar and then forget it, or having a conversation and say, oh, that was nice and forget it, but really take individual, institutional, and collective responsibility to see next year changing significantly. Like I tried to point out at the beginning of my talk, to Kristen's point, the counterfactual of preventing outbreaks is there is no news on the media. But that is our responsibility to really make it front and center, that what we do saves lives every day, saves economic means for many people every day. So I really want to thank you very much for sharing that with us, and also continuing your collaboration with JPIGO today and in the days and months to come. And everyone who tuned in today, thank you very much for your time and for your active participation. I wish you a wonderful evening, day, or morning, and hopefully we'll see some of